If you suffer with dry, dehydrated skin, then you may very well know that finding the right skincare routine for you can be extremely challenging. Dealing with issues of tight, dull, dry skin can really take the fun out of skincare. But with a little help and guidance and the right products, you can get your skin hydrated and glowing in no time. We chat to dermatologist Dr. Ian Webster on what should we be doing to keep our skin healthy and hydrated. Dr. Ian, welcome back to the show.
Thanks very much. Thanks for having me.
Oh, doctor, skin, dry skin, oily skin, and combination skin. I mean, how would you diagnose someone with dry skin? And what are some of the signs you'd be looking for?
Well, first of all, on the history, it's often people that have had a dry skin since birth. They might have a history of asthma or hay fever, and often their skins look red, scaly, rough, cracked, and sort of a lifeless-looking skin.
Is dry skin genetic, or is it something that's formed over time? Why is it that some of us form dry skin and suffer from it?
Yeah, it's purely a genetic abnormality. It's a whole group of conditions called the ichthyoses, where there's a defect in the proteins in your top layer of the skin, and it's reasonably common. So just some people are just born with that. Most of us are born with a normal skin. And then often if we use the wrong products, harsh soaps, etc., then we can dehydrate our skin or dry it out.
Wow. Now, over the past few months, Doc, many of us have remained indoors in dry, cold conditions. Now, how do these factors and many other factors contribute to dry skin?
So especially in the high veld, where it's cold and the humidity is very low, that is where your skin will get dehydrated and much drier. So just the cold air holds less water in it, and as a result of that, it becomes drier. Also, heaters, fires, all those sort of things, heating often will also dry out the skin.
Wow. But then, Doc, if we look at the spectrum then, what are some of the more serious conditions or forms of dry skin?
So the more serious ones, I've mentioned the ichthyoses. There are many different types. There is one called the harlequin fetus, where a child is born with this very dry skin, and that unfortunately might be fatal at birth. And then the other, which is very common, is what we call atopic eczema, and that goes with asthma, hay fever, eczema. They all go together. And in those patients with atopic eczema, you might get nasty secondary bacterial infections. You might even get a secondary herpes virus, where it's called eczema hepaticum. And those children or patients sometimes need to be admitted to hospital. So they can sometimes be more serious.
Wow. But then, doctor, I'm going to ask you right now to be quite specific in your answer. For those people with dry skin types, what would the most ideal skincare routine be?
Well, as a general principle, you want to take less fat out of your skin and put more back into your skin. Now, it's a little bit more tricky with this COVID pandemic because, especially with washing your hands, you want a bit of foam. So it's the foam or surfactant that kills off the virus. So if you're washing your hands, you want to use a cleanser that is mild, preferably close to the normal pH of your skin. Your normal pH of your skin is 5.5. So if you're washing your hands and you want to get rid of the COVID virus, you want a slightly foaming cleanser close to the normal pH of your skin. It's a personal preference whether you want a bar of soap or a liquid cleanser. But if you're just at home and you're just showering or washing, then you don't necessarily have to have a foaming cleanser. Then more creamy cleanser. And then you want to apply a moisturizer that is similar to the normal fats in your skin. So you've got fats in your top layer of your skin. So they're moisturizers that mimic the natural fats in the skin. And these are often free fatty acids, cholesterol, ceramides. So you want to look at ingredients in the moisturizer that actually mimic your natural fats in the skin.
Wow. Okay, thank you so much, Dr. Ian Webster, for breaking down how people suffering, unfortunately, with dry skin can bounce back and bring back that hydration and bring back that clean skin that we all so fondly look forward to. We appreciate you as you usher us into spring season. Goodbye.
Bye. Thank you very much. Thank you.
The dry South African climate can be harmful to your skin, especially if you're already battling with dry skin. It's time to take charge of your skin. Dexeryl skincare range is formulated specifically to treat dry skin and conditions such as atopic dermatitis, giving your skin the love it deserves.
Do you have dry skin caused by hand sanitizing? Keep the moisture balance with Dexeryl, scientifically proven to restore dry skin. Dexeryl, evidence makes us.